Congestive heart failure is a condition in which a heart is unable to pump the blood at required rate. Now, what happens when heart is unable to pump the blood? Then certain conditions arises, like when left from left heart aorta arises and it supplies blood to the multiple organs. And the most prominent important effect of the congestive heart failure will be activation of renin-angiotensin-aldosterone system. So the mechanism of congestive heart failure is decreased cardiac output, and it results in neurohumoral activation. Sympathetic nervous system is activated, which results in vasoconstriction and increase afterload. In turns, increase blood pressure and cardiac work also increases. Renin-angiotensin-aldosterone system is activated, which results in sodium in water retention and increase intravascular volume, which in turn increases blood pressure and cardiac work. So there are different types of congestive heart failure, like systolic dysfunction, and another is diastolic dysfunction. In systolic dysfunction, there is impaired contractility, impaired systolic phase, and low ejection fraction is there. It is of multiple there are multiple causes. Ischemic heart disease are in MI. Most commonly systolic dysfunction occurs are in hypertension, valvular heart disease, dilated cardiomyopathy, myocarditis, hemochromatosis. Alcohol and thyroid disease can give rise to the systolic dysfunction. And the diastolic dysfunction is impaired ventricular filling during diastolic phase, and in this condition there is normal ejection fraction. It occurs because of hypertension leading to myocardial infarction and left ventricular hypertrophy, valvular heart disease like mitral stenosis and aortic stenosis, hypertrophic cardiomyopathy, restrictive cardiomyopathy, constrictive pericarditis, and cardiac tamponade can give rise to this condition of diastolic dysfunction. Now, clinical features of heart failure. Heart failure is there are two types. One is left-sided heart failure, and another is right-sided heart failure. As the normal anatomy of heart, uh, we have seen that this is heart, and it is divided into four chambers: upper are atria and lower are ventricle, right-sided heart, and then there is left-sided heart. From right-sided heart, there arises pulmonary arteries which carries uh, deoxygenated blood to the lungs, and in left-sided there comes pulmonary veins which carries oxygenated blood from lungs, and from left ventricle aorta arises which supplies the blood to the whole body. So when left side of the heart is failed, then what happens? It is most common type of the heart failure. It is also known as forward failure, in which left side of heart is unable to pump the blood, and uh, there may be causes like pulmonary congestion and pulmonary edema. And clinical features of left side of the heart will be dyspnea, difficulty in breathing. Orthonia means dyspnea on lying flat, and on lying flat there is increase in venous return to the heart that results in dyspnea. Paroxysmal nocturnal dyspnea, and C3 heart sound. First cardiac sound is heard. Bibasilar inspiratory crickles with functional mitral valve regurgitation. Cardiac asthma like expiratory wheeze, and peribronchial edema is present in left side of the heart failure. And another type of the heart failure is right side of the heart failure. So right sided heart failure is present when right side of the heart is failed, and then there are also different causes of right side heart failure. It is causes are the because of left side of the heart failure, right side becomes fail. Chronic lung disease, pulmonary valvular stenosis, or pulmonary embolism can cause right sided heart failure. Clinical features will be jugular venous distension, right sided S3 S4 heart sound will be heard, functional tricuspid valve regurgitation, painful hepatosplenomegaly, ascites, and edema with pedal edema, pitting edema, and generalized edema can be present in the right side of the heart failure, because blood from the journal systemic circulation is not coming into right side of the heart. That's why these all causes arises. And the another cause is high output failure. It refers to congestive heart failure in which failure of a high cardiac output occurs. Causes are severe anemia, wet beriberi, atrioventricular fistula, Paget disease, hyperthyroidism, pregnancy, mitral regurgitation, and aortic regurgitation. High output failure occurs. So, the investigations of the heart failure will be blood tests like CBC, LFT, and cardiac enzymes. BNP will be checked. Chest X-ray shows cardiomegaly and pulmonary edema, and X-ray ECG of the heart will show ischemia, left ventricular hypertrophy, or previous MI ischemia will be present. Heart block and arrhythmia will be there. Echocardiography shows most important of all tests of the congestive heart failure. Based initial test is trans thoracic echo, and transesophageal echo is also performed. So in this way we can check the heart failure, and then the management will be done. Lifestyle modification is the most important primordial prevention of the heart failure. Then management of the systolic dysfunction with AC inhibitors, beta blockers, spironolactone, hydroxy, nitrates, and implantable defibrillators. AC inhibitors is also given, and there are certain side effects of AC inhibitors like dry cough. Captopril can cause dry cough, hypotension, renal failure, hyperkalemia, angioedema can be there because of enalapril, and in this way we can treat. ARBs, angiotensin receptor blockers, should also be given like valsartan and other sartan drugs, and the side effect of these drugs are the renal failure and hyperkalemia. Beta blockers should also be given. Diuretics in order to decrease the excess fluid, and potassium sparing diuretics and hydrolyzine nitrates with ivabradine medications, and digoxin is also given. And non-pharmacological treatment are cardiac resynchronization therapy, implantable cardiac defibrillator, ventricular assist device, and cardiac transplantation is the final choice for the management of the congestive heart failure. So in this way we can manage the patient of the heart failure, and we can treat this patient.